So over the last 6 months in Malaysia, we've recorded about 50,000 cases of dengue from January to June 2020. My name is Dr. Sanker. I'm from KPJ Selangor. Today, we'll talk about some basic facts about dengue, and that may help you through understanding the dengue infection. Now, dengue is a viral infection and it's caused by a dengue virus. There are 4 strains of dengue or 4 subtypes. So if someone gets dengue once and after a few years the mosquito bites the patient again with another strain of dengue, he can get dengue again. So in theory, a patient can get dengue 4 times in his lifetime. Dengue is actually carried by the Aedes mosquito. So it's a vector-borne disease. So we need to keep our surroundings clean and make sure there's no stagnating water. So that's with the help of public health as well as our own people. We need to keep our surroundings clean. Now, when we come to the symptoms of dengue, most people with dengue will experience very high-grade fever, and with chills and headaches, body aches, loss of appetite, and they may feel nauseous. During the first 3 days of dengue, most patients will have very high fever. The next few days, the 4 to 6 days, usually is the critical phase of illness. During this time, the patient can have complications. After the dengue subsides, some patients may develop a rash that's itchy. You can see this graph here. Now, the first 3 days, most of the time, there's high-grade fever. After the next few days, the 4th to 6th day, during the critical phase, the fever actually comes down. But during the first 3 days, if you look at the blood counts, they're actually quite high, the platelet count. And after that, the platelet count starts to drop during the critical phase, and during recovery, the platelet starts to come up. So this is important to know. So some patients with dengue, actually when they see the doctor early, the blood test may be normal. So the doctor will actually ask them to come back for a retest or come back for another blood test. So again, initial blood test may be normal in dengue, but if you still suspect dengue, you may need to come back for another blood test. Now, the other special blood tests that are done for dengue, the first 3 days, you may need to consider doing a dengue NS1 antigen test. And a bit later in the illness, most patients do a dengue IgM test. So platelet counts and these special tests are usually ordered by the doctor when you see them at the clinic or hospital. Now, once someone has dengue, they may or may not be admitted to hospital. So the doctor will decide whether the patient just needs to come for follow-up as an outpatient and then do blood tests every day. And based on these results, the doctor will decide when is the right time to admit the patients. Some patients may never need to be admitted. They just need to monitor the blood counts and see the doctor over the 1 week. Dengue usually lasts for 1 week and most patients recover after that. But some patients who are admitted to hospital are given a drip and other medication during the critical phase. So dengue is a common infection and we need to be aware about it. And if a patient has fever and feeling unwell, they should go to a clinic or a hospital and get their blood test done. The initial test may be normal, but they may require follow-up blood tests. If a patient has mild dengue and the doctor says should rest at home, then plenty of rest, plenty of fluids, and fresh fruits and vegetables would probably be what is recommended. And patients need to come for a follow-up blood test. Now, I hope that you are able to understand dengue a bit more, and please take care of your health.
Sekiranya ada persoalan,
you can go to
our official website,
Facebook ataupun Instagram
KPJ Selangor
Specialist Hospital.